Good evening. I'm Terry Franzine, co-founder and president of Haiti Companions. Thank you so much for joining us this evening for Celebrating Healthier Haitians. I hope you've seen our most recent annual report. Here it is. If you have not, you may see it on our Facebook page and on our website. The report includes a quote from Scottish historian and philosopher Thomas Carlyle. He who has help has hope, and he who has hope has everything. I've thought a lot about this idea since first reading Carlyle's quote, hope. This is what Haiti Companions gives to the people in the communities that we serve. A mom hopes that our doctors will be able to make her child feel better with a proper diagnosis and treatment. A man hopes he will be able to eat without pain after visiting our dental clinic. Another mom who sews to make money for her family hopes that she will be able to see better after she visits our eye clinic and receives glasses. An older woman hopes that she will feel better after she receives treatment for her hypertension and diabetes. These seem like very simple hopes to those of us who live in the United States. But for many people living in Haiti, these are only dreams because they do not have access to medical, dental, or eye care like Haiti Companions provides. So we hope tonight you will enjoy the rest of tonight's program. And after you learn more about the communities we serve and our staff, we hope that you will give generously to allow us to continue this life-giving work. Thank you so much.
Good evening, everybody. My name is Dr. Diane Pizy. I'm one of the co-founders and the medical advisor for the board of Haiti Companions. I live in Minneapolis, Minnesota, and I'm delighted to be here with our country director, Dr. Gamaniel Pierre, who's been working for us now for a year and a half and is doing a wonderful job. So welcome, Gamaniel. Gamaniel lives in Léogâne, Haiti, and he's talking to you from Léogâne, Haiti. Gamaniel, we're so pleased to have you as our country director. And we know that this has been a very difficult year, very difficult 2 years in Haiti. Tell us a little bit about the situation in Haiti and how it's affected the clinics and your ability to conduct the clinics.
Good evening, everybody. I'm Dr. Pierre. I'm in Haiti. It's a pleasure for me to talk to you this evening. The last year was very, very difficult for me and the staff of Haiti Companions in Haiti for many reasons. First, after losing our 2 clinics in Colin and in Jasmine because of gang violence, we make all those clinics, all the 3 clinics in Tibucan because of most of the people in Port-au-Prince and Gressier had moved to Tibucan since the gangs violence in Haiti. So because of this crowd in Tibucan, and the Tibucan is the safer area close to Gressier. So we made all the 3 clinics in Tibucan. Secondly, this situation, the gang violence affected deeply Haiti Companions and Marek and the staff because the price of the medicine. Since the gang violence, there is no path to go to buy some medicine in Port-au-Prince. It's more and more difficult to find and to buy some medicine. And to take the medicine to Port-au-Prince, from Port-au-Prince to Léogâne, it's very, very difficult. The best way, the current way now is by motorcycle and sometimes by boat. And in the path that the motorcycle used to go to Port-au-Prince to pick the medicine, when it rains, it's very difficult. It's impossible to use this way. Since 1 year ago, the main road has blocked and because of the gang violence. So we have to use different way to go to Port-au-Prince for buying medicine, and that increased a lot the cost of medicine. And finally, and because of the gang violence, we lost many routes to go to Tibucan. We lost if the first one, the second one, and now we use a very difficult route to go to Tibucan because of the gang violence. We need to keep the staff safe, and when we use many different routes and some difficult routes, we have to pay more. We have to pay the motorcycle much money, and because now before we went to Gressier to take the motorcycle. Now the motorcycle have to come in Leogan to pick the staff to go to Tibucan. That's very difficult for us and very difficult for the staff. And the staff, when we go to Tibucan, all the staff are afraid, are very scared. And the last time we need to find a lab technician, everybody are scared to go to Tibucan because they are afraid of gang violence. That this situation affect deeply Haiti companions activity in Haiti.
Wow, it's just amazing that you all have the courage to keep going. And it's so wonderful for the people up there, of the people of Tibucan and the people from Colin and Jasmine that are still going to those clinics. We really appreciate your courage and your dedication. So tell me a little bit about how many patients you're seeing and what are the most common illnesses you're seeing up at Tibucan.
The most common illnesses that we have in Tibucan are high blood pressure, respiratory infection, and gastric with H. pylori infections. That's the most common. Each month we can have about 40 to 50 patients with a gastric with H. pylori infection.
And you're seeing between 60 and 100 patients at every clinic, right? You're seeing up to 100 patients sometimes.
Yes.
Wow.
Yes.
So this year, you asked to start testing for H. pylori, which is a bacteria that causes severe stomach inflammation, gastritis, ulcers. Tell us a little bit about how that is going with testing for H. pylori.
For testing H. pylori, we hired a lab technician, and we have some tests we can do in Tibucan, and some we have to take the blood and to come in Leogan to make those tests. So sometimes we make them in Tibucan. Sometimes we come in Leogan with the blood to make those tests in the laboratory.
Yes, and that will make a big difference in patient treatment because you can identify it and then treat it.
Yes, that makes a big difference. Yes, because sometimes the patient asks for having those tests. Everybody knows a lot about H. pylori. Sometimes they ask for having this test, for having the H. pylori test.
That's so good. That's so great. We did increase the budget a little bit so that we could do this blood test for H. pylori.
Of course.
Yes, right. And then also, you've been able to start, or you're going to start testing hemoglobin to detect anemia.
Yes, we want to start to test hemoglobin, but you know, when we first start with the H. pylori test, we have too much patient. You know, everybody need to have H. pylori test. So I took this month to do many H. pylori tests, and next month I will start with the hemoglobin. You know, beside the H. pylori test, we make malaria, we made urine, you make a lot of tests. So next month we will start with the hemoglobin test.
Yes. And for you watching this, it is a rare thing for people to be able to get blood tests up in the mountains. And
Yes,
I feel included. Yeah,
yes, they are very pleased.
good, 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 good. Um, so Gamanielle, what else would you like to tell us about the clinics and how things are going?
It's a it's very important for me and for the staff. It's very difficult. Sometimes when we heard a lot of bad news about Gressier, sometimes the staff are very care. Sometimes they don't want to go. So I do my best because I know the people need those medicine. The people need to have um, um, a healthcare. And when we go there, when we find someone who need deep healthcare, we used to go some money to take motorcycle to come in Logan. Now the people don't want to come in Logan. They are afraid of Logan.
Right.
They don't want to go. I have to try to say them there is Logan is safe because they think Logan is as dangerous as Provence. They don't want to come in Logan. So we need to go up the mountain to find them because they don't want to come in Logan to find to have healthcare.
Right.
So we have to do our best to keep the clinics up the mountain because um, there is no way there is no health infrastructure over there. So Haiti Companions is the one we go up the mountain and to help those people to take care of them.
Right. And so for all of you watching this is becoming more and more important. And we so appreciate your support, and we can use more support to keep paying the staff and buying the medicine, which, as you heard, is more expensive, and to do the lab tests we're doing. And also, we have dental care and eye care, which instead of every 3 months, we've increased to every 2 months because people are really needing the dental and eye care. So, Gamanielle, thank you so much. We so appreciate your hard work. We so appreciate your dedication. We want you to pass our thanks on to the staff, who is so wonderful and so brave and courageous. And thank you all for watching.
Thank you, Dr. Pezzi. Thank you for all the members of Haiti Companions. And thank you for our donors. Um, I I would like that they give much money, more and more money, because we need a lot of healthcare. We need good
Yes.
healthcare, and without your help, without your donation, Haiti Companions could can keep going, keep working in Haiti. And thanks a lot. Thanks to our donors.
Hello, my name is Cynthia Miller, and I'm a nurse in Minneapolis and the secretary of the board of Haiti Companions. And I'm here in conversation with Cordeline.
Hello, I'm Aldine Fabiola Rijui. I am a nurse practitioner. I was the first group of nurse practitioner in Haiti. I am an associate dean at FSIL. I am responsible of the practical part of for the nursing students. And I live in Leogan, and I have 2 kids, 1 boy and 1 girl.
Well, thank you so much for joining us. I think that the people who support Haiti Companions will be really interested to hear more about you and about the work that you're doing with Haiti Companions.
Thank you.
First question that I had was, it's so impressive that you've gone on to do the education as a nurse practitioner. What inspired you to continue your education and become a nurse practitioner?
What inspired me before my nursing, I become a nurse. I want to be a physician. I want to be a physician. Since 2 years at nursing school, I don't want to be a nurse. I receive what they can call a professional call to be a nurse after the earthquake, and I work with a lot of nurses who came from United States, and I learn from them. I can have my master's degree and I can have my PhD, so I can work like a physician. And at the moment where PHH Haiti promoting health in Haiti came with the program at FSIL, I choose to be one of them. That was not easier for me because I have my son was a toddler. That was very difficult. And before my graduation, I have my girl. And since the period I have to suffer with my toddler and a pregnancy where I was very sick, but I did it. Yes, I did it, and I'm so proud of me. My kids also, so, they so proud of me, and I work like nurse practitioner, and I also do a lot of community services because I work at Leogan radio station. I make some talk show about health, and I help. I help and I also with my mother. I also go in the mountain in Dufour. We do a clinic, a mobile clinic every month for the people, because in that area they don't have any any hospital or a health center, but I try to do my best as a nurse practitioner in a
Wonderful. How do you balance in going to the mobile clinics like you do for Haiti Companions? How do you balance your personal safety in this difficult time in Haiti and your desire to provide the care to the patients in Tibucan and where the clinics are held?
Sometimes I'm so very afraid to go to the mountains when we have to go for the mobile clinic, but we are professional and we are health professional. We need to do our best. Now we can't take the best way to go to the place we have to go, but we have to try other way. Sometimes maybe Labu or when, but we try to do our best. And in the mountain, when we have to take taxi, motorcycle taxi to go to the mountain. Sometimes it's very difficult because they don't have the best the way didn't properly prepare to us to go, but we do what we can do. And despite all those challenges, every Saturday when we have to go, we go.
Yeah, well, we are so grateful. And I know that the people in Tibucan, the people who come to the clinics are so
Yes, because sometimes we have a patient, we can't wait. Maybe the patient with high blood pressure, with high blood sugar, we have to go to control for them, give them medicine. Since that, maybe when we go, we can have 4 or 3 of them died to prevent that. We have to do our best to go.
Yeah. Do you sometimes have to take a longer way up the mountain to get there?
After the mountain, we don't have to walk a longer way, but we have to put another mountain to go on the site where we have to do the clinical.
To get there safely.
Yeah.
What do you think are the most important? You mentioned high blood sugar and high blood pressure. Are those, do you think, some of the most pressing health needs that you see in the clinics?
I think both of them are very important, and some other problem we really receive that skin problem because a lot of people leave Port-au-Prince, Gressier to go out there, but the place didn't have capacity to serve all those people. We have a lot of skin problem, a lot of gastric problem, like H. pylori. We have a lot of them.
Okay. I've noticed we get the clinic logs, and it seems like there's a lot of gastritis, a lot of
Yes.
problems. So do you feel like some of that is related to the living conditions because
yes,
it's so
yes.
crowded? Mm-hmm. If you were going to make suggestions of, make a suggestion of an improvement for the clinics, what would you say? If there were something else to add to the Haiti Companions clinics?
Maybe my dream is big. I'm gonna tell you. I wish we can build some health center for the people. Yes, because going every month, that helps. But if we can be there every day, and the people can come, they don't want to wait until 1 month to come.
That's a good dream.
Yes.
That would be wonderful if they could have the services more frequently and be available whenever people needed to have the services.
Yes.
Yeah. Anything else that you'd like to share about your work with Haiti Companions?
I hope we can, the country can be safe again, and we can do more clinicals and more area because they really want it. The people really want it, and maybe we can go on other area after Gressier.
Yeah.
I wish that.
Well, we will keep that in mind, and we're always hoping too that we can increase the services, and we all are hoping for safety and stability in Haiti.
Yes. Thank you.
Well, thank you so much for talking to us, and thank you again for all that you're doing in the clinics for Haiti Companions.
It's a pleasure. Thank you for helping my people to have access to health. Thank you so much.
Thank you.
Hello, I'm Dr. Richard Smith. I'm a dentist, but I'm also a member of the board of directors of the Haiti Companions. Thanks for joining us today. I want to share with you some information that you probably already know. Haiti is in dire straits. There's a lot of turmoil going on there, and we're having a difficult time trying to bring health care to the folks in the mountains. There's no electricity there, but that means they don't have a lot of things, including toothbrushes and toothpaste. So we've been doing a lot of health care for a while. We've done some dental care, But this year we've got a new dentist join our staff, and that's Dr. Orisme. Dr. Orisme is joined with Dr. Gamaniel Pierre, and he is trying to bring some dental care up into the mountains. Most of it consists of providing extractions for painful abscessed teeth and doing drainage for people who have soft tissue abscesses. But we would like to do more. What we would love to do is to do some things that would provide more prevention so that we don't get to the point of needing emergency dental care. We would like to do sealants on children's teeth. We would love to do fillings while they're still simple instead of trying to wait until it's just a disaster. But we need your help because we cannot buy materials and ship them over to Haiti. That would be wonderful. We can't even send them a toothbrush. All that gets confiscated. So we have to buy on the local market. And that's why we're appealing to you to provide some more funds so that we can help these people. I don't know if you know, but there are only 400 dentists in all of Haiti to serve 12 million people. Can you imagine standing in line and being one of 30,000 people waiting to see a single dentist? So we're extremely fortunate that we have Dr. Orisme to help us, but we need to keep him and we need to give him some tools so that he can help us, help the people of Haiti prevent some of their dental disease. Thank you so much.
I'm Cynthia Miller, and I am a nurse in Minneapolis and the secretary of the board for Haiti Companions, and have the opportunity this evening to interview Claudine Cadio, who is an eye care specialist nurse with Haiti Companions, and we have also with us Sony Jean.
I am Claudine Cadio. I'm a nurse, and I have been doing this for 15 years. You know, as a nurse, I've been working as a nurse for 15 years. I am an eye, throat, and ears specialist. I receive advanced training in education, risk and disaster prevention, and first aid. I am an eye, throat, nose, and ears specialist. And it's a pleasure for me to work with Haiti Companion. I have been working as a nurse for Haiti Companion for 1 year, and I have been doing disease prevention and health promotion.
The first question I wanted to ask was what inspired you to get the special training for eye, ear, nose, and throat?
What inspired me to get special training in eye, throat, nose, and ears is because during training, I noticed that there were a lot of diabetes cases, and my mom has diabetes. That inspired me to get training.
The next question that I have for you, Claudine, is about how in this challenging time in Haiti, how you balance your personal safety with being able to provide care in the community like you're doing.
You know, when you have a passion for what you're doing, you will figure out a way to do it. You will figure out a way to reach people. And sometimes the areas are not safe. The areas where we have to reach the patients are not safe. When there is a safety concern, what we do to make sure that we are going to be safe, that the patients are going to be safe, we always inform them that we are coming. We inform we inform the local leaders to know about the situation before we come. Me personally, when the situation gets complicated, we try to find other clinics in other areas. We make sure that both us and the patients are safe.
Yeah, we have heard that, and we're so grateful for all that you do to make it possible for the clinics to happen and for the patients to get care. I want to thank you, Claudine, so much for your passion for this work. And I can just hear in the way that you talk about it how dedicated you are to providing this wonderful care to the patients who come to the Haiti Companions clinics.
Thank you to Mrs.
Thank you for thinking about ways to help us. I am thankful for Haiti Companion for this program or for this initiative. When I reach people, I see that they see me as a messiah. When I provide care for them, they see me as a messiah because this is something that they really needed. They were thirsty of that because you know that people are like, it's like they're running away from problems. They really needed that, the eye care. I am very thankful for that also because our resources in Haiti are limited. And I hope that this program will not be limited in Tibuca. That's what you call the area. I hope that this program will be extended to other areas in Haiti. And I would like this program to be implemented in my area.
Well, thank you so much for taking this time to meet together and for all of your work. And we'll hope to talk to you again in the future. Thank you so much.
Hi, I'm Jennifer Anderson, Treasurer for Haiti Companions, here to talk about the finances. In 2024, Haiti Companions provided dental, medical, and eye care services to over 3,100 patients at 3 clinics per month. During the first half of 2024, those clinics alternated between Cullen, Jasmine, and Tibucan. After June of 2024, due to the increased strife, all of the clinics have been hosted in Tibucan, and we have consistently held 3 clinics per month. Last year, Haiti Companions had an expense budget of $93,175. The budget is funded primarily by contributions from the public, community groups, and Haiti Companions board members. We thank you for the support received from all donors. Some additional funds are received in the form of patient fees for those able to pay. Care is provided to all patients regardless of ability to pay. Funds are used in 3 distinct categories. In 2024, 44% of the budget went to clinic salaries and expenses, while 51% was allocated to medicine and supplies, and we managed to keep admin expenses to just 5%. Medicine and supply costs continue to increase and exceeded all other costs in 2024. The fees from patients pay for the use of schools to host the clinics and provide additional care beyond what the clinics are able to offer. We continue to work to offer additional services at every clinic with the limited resources we have. We strive to keep the administrative budget as low as possible. The Haiti Companions Board is 100% volunteer with no compensation. Main administrative costs are for our website, bank fees to wire funds to Haiti, and fees for Network for Good, which facilitates online donations. We appreciate any amount that you can provide and thank you in advance for that donation.
Thank you so much for joining us for tonight's presentation. We hope you learned more about the communities we serve and the people who serve our patients. After watching tonight's presentation, we hope that you will give generously. You can do that through our website, through our Facebook page, or through the QR code that's showing on your screen. Without your donations, we're not able to continue this life-giving work. Thank you so much. Merci en pile.